I'm not an advocate for medical marijuana as a treatment for opiate addiction. I'm not an advocate for using an addiction to treat another addiction. I think there is a role for medical marijuana in terms of treating chronic pain, like cancer pain or pain from Crohn's disease, for some seizure disorders, and for people that have lost weight because of HIV/AIDS or chemotherapy or certain cancers. So I'm not an advocate for medical marijuana for addiction, because I think when you're talking about addiction, you're talking about a chronic disease of the brain that changes the brain chemistry. All drugs of abuse release dopamine into the reward pathways that's out of proportion from any natural rewards. That's true of opiates, that's true of cocaine, and it's true of marijuana. So it's a little bit like kicking the dragon, that you think about taking a little bit of a less lethal drug like marijuana, and that's still going to release some dopamine into the system. But when you have an addict brain, you're going to want it to have more dopamine and stronger, more powerful drug released into that system once you've kind of triggered that dopamine release. And so I think there's a high likelihood that it's going to lead back to opiate addiction when you start with marijuana, and we see that a lot in treatment. While I'm not an advocate for medical marijuana for opiate addictions, I'm an advocate for really keeping an open mind about doing whatever we can to keep our opiates addicts alive. This is a crisis. Our young people of all ages, are dying of opiate addiction on a daily basis. And we need to understand that we don't have all the answers right now. We need to start thinking about this disease as being a 365-day-a-year disease. And it doesn't take off for weekends, and it doesn't take off for holidays. Probably the most heartbreaking thing in my life is when somebody I've worked with, somebody I've cared for, somebody I've come to care about, I get the news that they've died of an opiate overdose. And we need to put our heads together and collaborate and come up with what kind of interventions or combinations of interventions are going to make a difference for our opiate addicts and keep them alive. And so that can be things like detox. For some people, it can be rehab. For some people, it may be medication-assisted treatments like naltrexone or Vivitrol, or partial agonists like Suboxone or buprenorphine. We really need to be thinking about all sorts of things that we can do to help keep people alive. We take away their drug, and what do we replace it with? Well, I think we need to we replace it with connections. We can replace it with connections with a therapist, connections with a sponsor, connections with a community or a support group, fellowship through AA, NA, and eventually we want to connect them to a path in their life where they might find some fulfillment, find some passions, and hopefully live a long drug-free life.